Next, we shall see look upon the structures which are associated with these muscles. So the first thing I am going to discuss about the raphe. Raphe is usually the midline fusion or the union of symmetrical structures by fibrous or tendinous band in the midline. For example, pharyngeal raphe and pterygomandibular raphe. So you can see the median pharyngeal raphe here, where the superior, middle and the inferior constrictors, they all meet in the midline, forming a wide tendinous ridge like, which is called as pharyngeal raphe, which is example. And pterygomandibular raphe, where we can see the superior constrictor muscle attaches here to a tendinous intersection called as pterygomandibular raphe. And even the anococcygeal raphe also, where the levator ana and coccygeus muscle, they converge here to the anococcygeal raphe. Pharyngeal, pterygomandibular and anococcygeal raphe. So that was about the raphe. Next, the structure associated with the muscles are the ligaments. The ligaments are the fibrous bands that connect the bones to bones, or cartilage to a bone, or cartilage to cartilage. In some context, especially within the abdomen, the fold of peritoneum, which serves as a support to the visceral structures, are also considered as ligaments. So ligaments are composed of dense connective tissue, mainly the collagen fibers, and the direction of the fibers being related to the stress which they undergo. So in general, the ligaments are unstretchable unless subjected to prolonged strain. And a few ligaments such as the ligamentum flava between the vertebrae, we can see the ligamentum flavum here, between the vertebral laminae, and ligamentum nuchae in the back of the neck, are made up of elastic fibers which enables them to stretch and regain the original length thereafter. So the ligaments are usually attached to the bone at their ends. So you can see at the around the knee joint, and these are morphologically, developmentally from the tendons of some other muscles sometimes. And so we can see usually they connect the bones to their ends, and we can see even the peritoneal reflections around the liver I am shown here. So there are several peritoneal reflections in the abdomen supporting the visceral organs, which are also considered to be ligaments. And the muscles are associated with these ligaments, especially around the joints. Next, the tendons and aponeurosis. The tendons are the fibrous bands or the dense connective tissue that connect the muscle to the bone or cartilage. We can see the tendon is this white part which connects the muscle to the bone, and it is a non-contractile tissue. It doesn't have any muscle cells in it. It is simply made up of collagen fibers, bundles of collagen fibers. And these tendons are supplied by sensory fibers extending from the muscle nerves, and they are similar structure to the collagenous ligaments and attached to the muscle to the bone, and they may be cylindrical like tendon. If they are flattened sheath like structure, they are called as aponeurosis. You can see if it is flat sheath like structure, it is called as aponeurosis. Aponeurosis are well demonstrated in the abdomen as well, in the walls of the abdomen, made up of flat muscles. So that was about the tendon and aponeurosis. The tendons have blood supply from the vessels which descend from the muscle belly, and anastomosis with the periosteal vessels at the bony attachment. Next, we shall talk about the aponeurosis. Aponeurosis is a fibrous sheath or expanded broad tendons that attaches muscles uh, to the bones and serves as a mean of origin and insertion to a flat muscle. So that is about aponeurosis. Next associated structures are the synovial sheaths and the retinaculum. Synovial sheath is the sheath which surrounds the tendon, where the tendons bear heavily on adjacent structures, and especially when they pass around like loops or pulleys of fibrous tissues or bones and change the direction of their pull, and they are directed by being provided by the synovial sheath. So this is the synovial sheath. In between, the gap is filled with the synovial fluid, which is produced by the membrane. So the parietal layer of the sheath is attached to the surrounding structure, whereas the visceral layer is fixed to the tendon. So inner visceral layer, the outer parietal layer, uh, and the two layers glide on each other because it is lubricated by a thin film of synovial fluid, which is secreted by the lining cells which present in the sheath, within the sheath. So the visceral and the parietal layer join with each other at the ends. We can see they are continuous with each other and ends to their extent. Usually they do not enclose the tendon cylindrically, and it is as though the tendon has pushed into double layers and closed sheath from one side. So we can see it is double layered, and from one side the tendon goes inside like a by balloon plunging, like that. So in this way, the blood vessels can enter the tendon and to reinforce the longitudinal anastomosis. In the other cases, the blood vessels perforate the sheath and raise up to the synovial fluid like a little mesentery or a verniculum. So as a flexor tendon of the digits, these are the flexor tendons of the digits can glide smoothly and they work smoothly. So synovial tendon sheaths are the synovial fluid filled tubular sacs surround the muscle tendons, and they facilitate the movements and reduction of function. That is about the synovial tendon sheath. Next, coming to this retinaculum. Retinaculum is a fibrous band. Usually it is the modification of the deep fascia, and these fibrous bands, they hold the structures in place like tendons, several tendons, neurovascular bundle, and tendons along with the synovial sheaths. They are all kept in position because of retinaculum. That is, you can see the extensor retinaculum on this side, and posteriorly the flexor retinaculum would be there near the ankle. Similarly, the retinaculum are present in front and behind the wrist to keep the tendons and neurovascular bundle in position. Next, the structures which are associated with the joint, with the muscles are the bursae. So, bursae are fluid-filled flattened sacs of synovial membrane that facilitate the movements by minimizing the friction. So, you can see the several bursae around the